Hello, good afternoon, everyone. I wanted to title my talk today, Moving Healthcare Forward. And then I thought what might be more interesting, less boring, and more applicable to young A-level taking students. And I thought I would name it Rejection Demands Reinvention instead. Because in growing Alami Clinic, I realized that we've gone through many rejections and we've had to reinvent new things. And I also realized that a lot of that rejection and how to take rejection is from my experience even before Alami Clinic. I want everyone to think of an old person that you know, a grandparent, or maybe even a neighbor. This is my grandma. At that time, there was no fashion of old people going to the gym or being healthy, She was the typical sort of oldie. She loved to cook, she loved to eat. So you can imagine, she got many chronic diseases. And as a favorite grandson, one of my duties, which I undertook very seriously, was to pack her medicines for her and give it out to her 3 times a day, including her insulin. Now, she took so many medicines and they increased, but I also wondered whether she was getting any better. And I also wondered, did I understand, could I understand her chronic diseases, what medicines she was taking? And I did feel that she rejected some of her healthcare because she tried things like, metal bracelets and soaking spices in water for blood circulation. And so I wanted to be a doctor. Now, that's only one reason why I wanted to be a doctor. The real reason was everyone said, Imran, you're doing well in school. Like many of you here, I'm sure, you're doing well in school, you should go on to do medicine, right? So I said, okay, I'll do medicine because I probably will get in. My grades seemed quite good. But I didn't. And that was the first rejection that I faced. And then I had to, take a step back and think of why I wanted to do medicine. And what about healthcare that I enjoyed? And I realized that what I liked was balancing ethics and patient care with building a business and managing the cost of running a business. And so I said, okay, I still want healthcare, and so next best after medicine is pharmacy, right? So, okay, go for pharmacy, because that's how we choose our degrees. And then, get a good degree, and of course, what else do you do? Anyone knows? Anyone can tell me? Get a degree, and then what's after that? Get a scholarship, right? That's like typical post-JC, right? So I applied for a scholarship, should get in lah. But I didn't. And I think these big rejections helped me to be more courageous in exploring what other things I could do. And so I signed up for a multidisciplinary program in NUS, where I did very interesting things like counting the number of trees in NUS, teaching kids coding, learning the physics of sailing, and exploring in all these fields outside of pharmacy helped me to come up with more research ideas and community initiatives. And before you knew it, I was juggling many things outside of what I actually went to university to learn. And that's something that I realized pharmacists also can do. Pharmacists can do not just patient care in the hospital, but we can do research, we work in pharma companies, and we even manufacture drugs. But I knew that I didn't want to, try all these different things. I knew I wanted to pick one thing, be good at it, and then try to reinvent and build something good out of it. And so I jumped into oncology or cancer. If you know people with cancer, people fear cancer, right? People say it's a death sentence, although nowadays we say it's a chronic disease. Because of the advent of science, we know how to treat cancers better nowadays. But with these treatments, we need to support the patients through it. And one of my roles as a pharmacist that I enjoy as a cancer pharmacist is to help patients deal with the toxicities of treatment so they can continue to, what I say, benefit from it for as long as they can. And so I was a very happy cancer pharmacist helping my patients and trying to push patient care even though we were struggling with manpower and the load in the public hospital. In 2022, my wife Farhan, she's here, she's a specialist in older people, she's a doctor, and she said she wanted to come out and open her own clinic. Of course, we could open a medical clinic in Gleneagles or Parkway, but where would the fun be in that? So we wanted to create something new. Sounds fun, right? So we thought about what different models we could come up with. And I remember I thought of my grandma and said, what kind of medical treatment would she appreciate? What kind of medical treatment would she deserve? And so we decided to build Alami Clinic. So our tagline is giving you the care you deserve. And we decided to build it in the community, not in a hospital or medical center, because we wanted to be accessible to patients. So how many people need geriatric care or older people care? We have 6 million people in Singapore, out of whom about 20% are above the age of 65. And the American Geriatric Society says 30% of them will need to see a geriatrician because of more complex medical conditions. So dividing that by the number of specialists we have in older people, each of them have to see 23 patients a day if they see the patients every 3 months. And that's not accounting for acute illnesses and home care patients, patients who can't come to the clinic. You have to see them at home. So definitely we knew that we had a market. So what's geriatric care? Anyone knows what's a geriatrician do? No? Well, the geriatrician, of course. Anyone else? Okay, so geriatrics is the specialty of older people. And so what's so special about them, right? Just get the liver doctor to see the liver, the heart doctor to see the heart. I mean, better, right? You get one guy to see everything. Better than to get one guy to see everything. But geriatricians, just to sum up, geriatricians care about what many doctors don't care about. They care about bowel movement, for example. And when we look at geriatrics and the way that geriatricians treat their patients, then you can understand, one day the nurse came to me and said, Imran, this lady, she's 75 years old, her cataract is so bad. She says she can't afford the surgery, but she's saving money to go on a religious trip. I don't understand. But if we think about what's important to the patient, then we know that we need to help her to go for this trip and manage her medical condition while she's on this trip. It's not about what we think is best for the patient, but it's what matters most to the patient. So that's just a quick idea of geriatrics. So sounds very good, right? A lot of people need a geriatrician. And why don't they get them then? Private healthcare, inaccessible to most Singaporeans, while public healthcare is inundated with the load. I just heard last week that some public hospitals have increased the limit for geriatric patients from 80 to 84, when we know that above 65 and complicated medical cases should see a geriatrician. So that's why we built Alami Clinic, to be affordable. We pegged it, I always say, young people spend about $200 a month on Grab. So they would be willing to spend this on their parents. So that's how we try to price an Alami Clinic. We're in the community, so rent is a lot more affordable. But we try to give quality care. We want to give good medical care, and that means we need a team-based approach. So it's not just the doctor. We have nurses, we have pharmacists, we've grown to have more doctors. But what's important is that we've built a team where everyone believes in the good work that we can do and giving quality care. So back to rejection, right? So building a business, you have rejection, right? You send emails to people, say, hey, we want to do this thing with you. And then they'll say, oh, maybe not, right? So more rejections. But I'm an expert at rejection, right? So I just, we had health screenings where we had 4 or 5 people turn up. So that's quite difficult and disheartening. But I did a lot of reading, and one thing that I like is this idea of the lean startup, where if you have a new idea, you test it a little bit, don't build it all the way. And then if you feel that people are taking it up, then you roll it out. Otherwise, we change the idea. And so we've become more successful. This is our vaccine drive that we did with a travel agency for pilgrims going on Hajj. And that is my toddler pushing the oxygen concentrator because everyone needs to work to bring the bacon home, right? So home care is a big part of what we do in Alami Clinic. So we have more plans to build pharmacy services, to work in nursing homes, to do hospital care at home, because we want patients to be comfortable. But we know with these growths come more rejection and challenges. So back to grandma. I have another grandma. And a few months ago, she said she was feeling giddy and tired. So this time, I know a geriatrician, right? So I bring her to the geriatrician. And geriatrician knows that blood pressure control in older people, just like our disposition towards them, needs to be more relaxed, right? So we ease up the blood pressure medicines. And she sends us a picture of her blood pressure reading. She's not very good with tech, right? So we monitor her, and she feels better, and she's back out and about. So I want to tell you that, well, my other grandma got the care that she deserved. But what do you guys deserve? You deserve rejection, because you're going to get it. You deserve rejection, because everyone deserves rejection, and you need to learn from that, and we pick ourselves up. Because just like in business, when we get rejected, we know what the market is ready for and what it's not, and what it needs. Yeah, this is the... And with that, thank you for your time. And yeah, thank you.